So in this part, we'll discuss about the histology of breast tissue. So histology also called as microanatomy, right? So mammary glands are specialized accessory glands. These are specialized accessory glands. Okay, now these are modified sebaceous glands. Evolved in mammals to provide nourishment to young ones through secretion of milk. Mammals, as we have discussed in the first part, right, in the introduction. So mammals have breast to feed their young ones, which will produce milk to feed their young ones. So modified sebaceous gland, these are specialized accessory glands, useful glands. So mammary glands, 15 to 20 lobes, same 15 to 20 ducts, same number. Each lobe many nodules, same number. So this is important for your PG level, because they will ask tricky questions, right? So how many lobes, how many ducts, so calculations part of thing, like they will ask, but just you have to remember this common sense, right? So lobes have same number of ducts. So each lobe many lobules, it's not same number. These are not same, but this is same. So remember. So you can see here, lactiferous duct 15 to 20. So for suppose like 1, 2, 3, 4, 5, 6, 7, like the 20, and the sinus, lactiferous sinus. So how many number of ducts? That number of sinus. So same 15 to 20 sinus, lactiferous sinus, and after that you can see lobules. So lobules many, so not equal number of, right, lobes. Lobules are different, right? So 15 to 20 lobes, but lobules are many. So this is acini. So we have discussed in the previous parts, earlier parts, right, about organization, right? So if we see the if we take this cut tissue and if we see in the microscope what is the arrangement of different cells, ducts, so this is the histology. So in resting phase in non-pregnant adult female, after the puberty, like reaching the puberty, adult female, non-pregnant, remember, you can see abundant interlobular connective tissue, of course, ducts of different size. So interlobular connective tissue. See here, you can see here the abundant ducts of different size. See this one, ducts of different size, intralobular, like mammary gland ducts. See, you can see different sizes, plenty of fat cells. See, these are the adipocytes, adipose tissue. So plenty of fat cells. Lobules ill-defined. Lobules are ill-defined. You can't able to see. So ill-defined. Mammary gland resting phase. So this, see, adipose tissue ducts of mammary gland, intralobular duct. So this is arrangement in the resting phase. So mammary gland resting phase or non-lactating phase, non-lactating phase, ducts and its branches. Stroma, connective tissue, fat cells, intralobular duct, low columnar epithelium in this intralobular duct. So you can see here columnar cells, right? Low columnar epithelium, intralobular connective tissue derived from papillary layer of dermis, cellular fibroblasts, and the interlobular connective tissue, interlobular in between two lobes, right? One lobe, two lobe, interlobular, one lobe, two lobe. This is one lobe, this is one lobe. In between these two lobes, interlobular connective tissue, abundant. Interlobular connective tissue derived from reticular layer of dermis. Layers of dermis, you have to know. So papillary layer and reticular layer. From papillary layer, cellular and fibroblasts, like cellular fibroblasts, intralobular connective tissue. The reticular layer fibroreticular. The lactating phase. In the lactating phase, chiefly acinar tissue, more acini will be present. Numerous secretory acini, see 2, 3, 4, 5, like many secretory acini. Lobules clearly demarcated. You can see lobules. See 1, 2 lobes. These are lobes, right? So lobules, you can see clearly demarcated. Ducts of various size as usual. Interlobular duct, small duct, see different size. It's lactating phase, as you can see clearly. This is the lactating phase. Histology of breast gland. Acini predominantly present with minimum amount of connective tissue. See, you can see connective tissue is scanty interlobular connective tissue in between two lobes. Scanty interlobular connective tissue. Acini is lined by tall columnar cells. In here, low columnar epithelium, tall columnar cells. Nucleus, round holes in middle of the cell. It's in middle of the cell. As here only they are given nucleus. So see, middle of the cell, myoepithelial cells between basement membrane and secretory cells. If this is the basement membrane and secretory cells, basement membrane, columnar cells, in between myoepithelium cells, like this. They are like myoepithelial cells. Differently they will be there. Myoepithelial cells. Ducts, fewer in number as compared to acini. Bigger ducts, stratified columnar epithelium. Just you have to remember this. That's it. Bigger duct have stratified columnar epithelium. You can see stratified, different layers. 1, 2, like this. Stratified, start-off layers. You can see. So here we complete the histology of breast. We have completed breast. So do comment if you want any other topics from anatomy like these. So I will be also making many topics. So feel free to comment. Thank you. Stay tuned.